It's about the COVID-19 pandemic. Joining Eagle News tonight is an internal medicine physician and former virologist in Maryland, Dr. Marcelo Sugitan. Doc, how are you?
I'm good. Ace and Eliza, how are you doing?
We're doing okay, Doc.
Thank
Thank you
you
for joining us.
How's the family doing?
Family's doing well, thank God.
Good. We have a couple of questions for you. It won't take too much of your time. It's probably 4 hours.
We have so many questions for you.
It's just that our viewers really need clarification.
Okay.
First things first, how are our doctors handling the pressure of this pandemic?
You know, to tell you the truth, doctors are a little bit anxious in taking care of these patients with COVID-19. Not only doctors, but all of the frontliners, as you have said it. Mainly because we're still not really familiar with how the disease presents itself. And we also are a little bit scared when we hear news that there's a shortage of personal protective equipment such as masks, lab gowns, gloves. And I can only imagine the hard-hit areas, how the physicians and how all of the medical professionals are dealing, like places in New York, in California, in Detroit, in New Orleans, and other parts of Louisiana. So, as you have said, we do live in interesting times, and as doctors, we have to uphold our oath to help all of the sick people, but we also have to look out for our families as well. So hopefully, in terms of the issues with the supply for these protective equipment or anything related to how we can more protect our first line responders against infection, then that will be a welcome news to all medical professionals.
You talk about fear. Not only the people, not only the nation is in fear right now, and as you mentioned, even the healthcare professionals are also having that emotion. It's really an unsettling situation right now. Well, people who are scared sometimes resort to self-medication. What are your thoughts about this?
I think that they should always consult their primary care physicians as much as possible, because there are a lot of information going on right now. All of them purporting to have found a cure for the COVID-19 disease. So we just have to really know and confirm where the source of information is coming from, to make sure that these are reputable sources, because a medication, each medication that we use, it has its benefits and it also has its own side effects or risks. And after carefully weighing the benefits versus the risk, then we do decide to either take it or not. So a lot of these medications, for example, the hydroxychloroquine or the chloroquine, that people have found to be have some activity against COVID-19. And the only thing is that there are no established clinical trials yet that can prove the efficacy of this particular drugs. So whenever we use this for a non-approved indication, because these drugs like the hydroxychloroquine, this is used to treat lupus, rheumatoid arthritis, and also for the chloroquine malaria. They also have their own side effects, such as gastrointestinal upset. It can also cause some vision problems. So we have to be very careful here. And until we have more time to study in a controlled setting, like what Dr. Anthony Fauci always says, the director from the National Institutes of Allergy and Infectious Diseases of the National Institutes of Health, these has to be done under a protocol where we can really say with certainty or with a little bit more clarity that they are safe or that they really work, because there's no need for us to actually take these medications. We don't even know what dose to take, and we don't know for certain whether if you take this as a prophylaxis or that is to prevent infection, if it really works, and you might suffer from the side effects.
You said the behavior of the virus is a little bit, or it's unclear right now. That's why a lot of people, once they feel symptoms or they think they have been exposed to the virus, they panic. They resort to, what am I supposed to do? What should I take? So resorting to self-medication. How do we explain to them that they shouldn't?
So if it's actually just, symptoms like you might have muscle aches, you might have a fever, but relatively you're still doing well. So you can take the same medications that we usually take when we have the cold, right? You take acetaminophen or Tylenol, right, for some muscle aches and pains. Or if you have a fever, then you also take the same. But if you actually feel like you're coming in or you're coming with a severe respiratory illness, you're feeling short of breath, you're running a high temperature, then that is the time that you have to call your doctor and say, I think I might have something more serious. And then they will direct you to go to the emergency department of any of the hospitals because you need urgent medical attention. So let us always be vigilant as well and really see what is it that how you're feeling, and always reassess. So in those particular circumstances, it's okay to try those medications because we know that they're effective, and when taken at the right dosage, they're safe. But when we're talking about medications that are not for their intended use or indications yet, that's when it becomes a little bit more dangerous or a little bit more murky because we don't really know that much about it yet.
You tapped on hydroxychloroquine earlier. There's this doctor from representing himself as an advisor to Stafford University Medical School of Medicine. And he said hydroxychloroquine combined with erythromycin. How's that? What's the integrity of this?
So I actually haven't seen the studies yet to comment, but what I know is that a limited number of patients have been tested for hydroxychloroquine and azithromycin, which is a similar antibiotic within the same class. The issue with hydroxychloroquine is that when they had a SARS outbreak back in 2003 in China, they were able to find out that this particular drug has some activity against the virus in lab experiments. And they also treated some of their patients with hydroxychloroquine, and then they saw that it actually reduced the amount of viruses that they were shedding. But as you know, even though SARS back then, it was caused by SARS-CoV-1 and SARS-CoV-2, which causes COVID-19. They are similar in many ways, but there are still some differences. Okay, so it's too early to tell whether what we see in lab studies will also replicate or manifest as an effective drug regimen when applied to COVID-19. But I'm sure that there are a lot of physicians and a lot of clinicians out there who's already testing this particular medications in this kind of context in treating COVID-19.
Thanks for clarifying that, Doc. Another question. There's a myth, actually, saying that water If you drink lots of water, it will
Hot
push
water.
it down.
They
Yeah,
say
hot
hot
water,
water.
that's right. Hot water sometimes mixed with lemon or anything with a high pH. Saying that if you drink lots of hot water, it will push down the virus to the stomach, and the stomach acids will kill the virus. How true is that?
Well, I'm not really sure
We sound like
about this
showbiz again.
lemon and water thing, but we always do things that gives us comfort.
Mhm.
And so if some people actually believe that this can ease their anxieties or that it actually works as long as for this thing it's relatively harmless, then I'm not seeing anything against it. But if you think about it, once a virus already infects the cells, so they're already inside the cells. So no amount of water that you actually drink will wash away what's already inside of your cells. So again, take it with a grain of salt. And if it's actually working for some, because it might be a psychological comfort, then it's okay. Because this particular concoction is relatively harmless anyway.
I would rather wash my fruits and vegetables with hot water than that would make
That
me
makes more
feel a
sense.
little better.
Yeah.
And also,